Welcome back, everybody. We're talking about an interesting topic here. Physician burnout is creating healthcare deserts across America, and one Atlanta area doctor is on a mission to fix the crisis before more communities lose access to care.
Yeah, that's right. Today we're joined by Dr. Lisa Herbert. Thank you so much for joining ATL Live Extra.
Thank you so much for having me.
Yeah, it's good to see you. We know you've spent over 20 years in the healthcare system, and now you have transitioned into leadership and training, really shifting the culture, if you will. Will you talk a little bit about that?
Yeah, absolutely. So my name is Dr. Lisa Herbert, as you mentioned. I'm CEO of Just the Right Balance, which is a coaching and consulting firm. And after 20 years of practice, seeing patients and being part of that community, and also after being part of healthcare leadership, serving in leadership roles, I really saw what was happening within the healthcare industry. There was a lot of communication breakdown.
Yes.
I saw my colleagues burning out. I went through burnout myself as a physician.
Yes.
So I knew that there had to be a solution to this problem. We had to find a solution to this problem because physicians were actually leaving. So fast forward to today, as a leadership coach and also as a healthcare coaching consultant, I help health systems increase, patients' retention, increase retention, also help them to build physicians up so that we can increase the number of physicians that are actually staying in medicine and not leaving.
So good.
And just kind of broadly talking about gaps in healthcare, people watching might think, oh, income, oh, race. I mean, those are very popular topics when it comes to that. So really, more directly, what are the gaps that you experience and that you see?
Yeah, so first I think I have to share a little bit about the numbers, right? So we are seeing a huge amount of physicians who are actually disengaged. 82% is actually the number that has been sort of going around in terms of surveys. So 82% of physicians are disengaged, meaning they're disconnected from their organization. They're showing up to work every day, but they're disconnected. And then there's also a high percentage of physicians who actually go through burnout. And that number has been 50% for a really, really long time. And it hasn't really moved. It's gone up as high as 63% during the pandemic.
Right.
And what happens with these physicians is that they ultimately leave, right? So numbers are actually showing that 44% of physicians are saying that within the next 5 years, they're looking to leave medicine.
5 years, wow.
Within the next 5 years, 44% are looking to leave medicine. So that coupled with the fact that 10,000 of us, probably retire just based on age or leave medicine for other reasons, it's really leaving a significant gap in terms of the number of physicians available to provide care.
And Doctor, we want to make sure we have enough time to talk about how you're coaching this kind of new form of leadership. I mean, it's very involved, to say the least. What is your approach for these new doctors?
Yeah, so my approach really is to come in and actually bring my lived experience, right? So I like to say that I speak 3 languages when I work with organizations. So I speak clinical, I speak corporate, and I also speak coaching. So clinical because of my years of experience, corporate because I've been in the corporate landscape, I understand the language, and then I bring in the coaching aspect because that helps to build the communication between clinical and corporate so that we can start having these conversations and so that physicians can feel valued and heard and that they stay and don't leave.
It's like the C-suite of communication right there.
Absolutely.
I mean, thinking from the patient's perspective, the next time I go into a doctor's office, whether it be big or small, what can I do to help? What can our viewers do to help?
Yeah, I think, empathy goes a long way. I think just being understanding and, the fact that, myself and some others may be raising the awareness about physician burnout and the things that are happening in terms of healthcare communities. Just being empathetic about sort of what's happening to physicians and understanding that this may be part of sometimes the problem when you say that my physician is not listening to me. Not to ignore it, but just really to have some awareness and understanding.
And in my mind, I mean, my physician's a superhero, but they are human.
And honestly, if you're not healthy, if our physicians are not healthy mentally, et cetera, they can't be at their best for us. So we appreciate these tips. Thank you so much. And you guys, we're going to push all of this on atlliveshow.com because we want you to get connected.